Hello, and welcome to the fourth and final video of our series. By now, you've learned everything you need to know about chiropractic and how it works and affects your life. So today what we're going to be doing is we're going to be landing this plane, taxiing it to the runway, and helping you embark on a lifetime journey of health and well-being, and including chiropractic as a piece and puzzle of your health regimen. So thank you for watching and enjoy today's video. Hello and welcome back. Today we're going to start off by helping you determine or look to see how you can determine if you need an adjustment while you're at home or if your kids need to get adjusted while you're at home. Then we're going to answer some commonly asked questions. So to start off, we always need to be asking ourselves this question that a good friend of mine, Dr. Stephen Judson, started asking us chiropractors, and that's simply, how's your atlas? If your atlas is subluxated, it's interfering with your brainstem, and that Houston control video comes into play, that chemistry of life video that we saw last time comes into play. But how can you determine if you need it? If you're just simply at home, what can you do? Well, look in the mirror and check your posture. And if your head is tilted to the right or to the left, I can all but guarantee that atlas has slid to one side or the other, and you need to get it adjusted. If you're looking at your kids and they have a head tilt, they need to get adjusted. Some other simple things that you can do is take a look at your clothes. If you're wearing long sleeves, is one sleeve shorter than the other? Is one sleeve longer than the other? Look at your shoulders. Does it look like one of them is sitting higher or lower than the other? That would indicate a tilt in your shoulders and maybe a subluxation in your neck. Look at your pants at the waist. Does one hip look like it's sitting higher than the other? Does your waistline look level? How about your pant legs? Does it look like one of them sitting longer on your shoe or shorter on your shoe than the other? These are indications that maybe you've got a lumbar or a pelvis subluxation that needs to be addressed. And so that brings us to the question of, well, what exactly is it that chiropractors do? And it's my job as a chiropractor to take care of your central nerve system. Your central nerve system, again, is made up of your spinal cord, your brain stem and spinal cord, as well as the big thing that we call our brain. Off of that spinal cord come all of the nerve roots which go down our arms, into our legs, and go to every single cell, every tissue, every organ in your body. And realize there's over 3 trillion cells making up the organs and muscles and tissues of your body. Every one of them is connected to your brain through your nerve system. So as we talked about in the previous video, the chemistry of life, if one of those organs is producing symptoms, that means your nerve system's not working well, you're subluxated, and a chiropractic adjustment could help you out. Because when your central nerve system shuts down, you shut down. In one of our first videos, we talked about Christopher Reeve. He was an extreme case of that subluxation. We don't want that to happen to you. And so we want you to get checked on a regular basis. That way we can keep these subluxations from being a big problem in your life. And that's the big concept, is that, you go to your dentist once every twice a year or so, but every day you're taking care of your teeth by brushing them. Well, I can't send you home with any kind of neural paste or any kind of spinal floss to get in between each of the bones. The only way that you can contribute to your own neural hygiene is to hop up on that table and get adjusted in order to maintain your neural integrity. And so the best way to utilize chiropractic is through a lifestyle. We give you a recommendation for your care based on the goals that you gave us. Now, if your goal is a short-term pain relief goal, we're going to give you a short-term pain relief recommendation. But realize that just because you're feeling better doesn't mean that we've corrected that subluxation. It doesn't mean that that atlas is holding any longer anymore. And you can go out into the world and do the things that you do and re-subluxate, and that's why you want to get checked. That's why you want to be regular with your chiropractic. That's why you want to be consistent with getting checked. Because the things you do out in your life are going to cause you to subluxate again, causing interference in your nerve system, reducing the chemistry in your body and resulting in a lack of performance. And so time and repetition are our friend. It takes time to correct that spine. It takes time to correct that subluxation. 6 to 12 months is not an unreasonable amount of time. So you want to be getting adjusted before those subluxations become a problem. And then once you get them corrected, you want to be getting them checked on a regular basis so that they don't create more or other problems in your future life. And that's why we always talked about getting checked, living a clear life, keeping your mind clear, keeping your spinal cord and nerve roots clear of any interference so that that communication between brain and body occurs the way it's designed to. And, people always ask us, do I need to get adjusted for the rest of my life? And the answer is both yes and no. Again, if your goal is short-term pain relief, no, when the pain's gone, we'll see it the next time it comes back. But for those of us who want to be healthy, those of us who look at health as consistently adding to our regimen, we're already eating well. We're exercising on a regular basis. Adding chiropractic is something that's going to help us absorb those nutrients that we're taking in. It's something that's going to help us get the most out of our workouts. And so for the rest of us, chiropractic becomes a lifestyle. And what I'd like to do right now is just give you some alternatives. Like if you don't get adjusted, well, what could happen? Because all it takes is 7 to 10 days of sedentary life. Consider the idea of spinal degeneration, which after 7 to 10 days of being sedentary begins the process of arthritis. And so my question for you is, if you get diagnosed with arthritis, and you probably know somebody who does have it, how long does that diagnosis last for? And likewise, nerve degeneration, how long does that last for? And the example here is Michael J. Fox, who is the spokesperson for Parkinson's. If you get diagnosed with Parkinson's or multiple sclerosis or Alzheimer's, that's all due to plaquing within your nerve system, specifically at your brainstem or on your spinal cord. Just like plaque gets on your teeth, this plaque can interfere with your nerve system, with your central nerve system. And if you get diagnosed with Alzheimer's or multiple sclerosis or Parkinson's, how long do those things last for? In both situations, arthritis or one of those nerve degeneration issues, if you answered the rest of your life, you would be correct because there's no known cure for those things. And so we have to be asking ourselves, well, what are we doing on the prevention side? What are we doing to prevent arthritis? What are we doing to prevent Parkinson's or multiple sclerosis or Alzheimer's? Because even here in our office, we've had patients with Alzheimer's come in and we start adjusting them, and their adult children come back telling us that their senior parents with Alzheimer's are now carrying on conversations in the moment. And so that helps them understand that getting adjusted and doing something for prevention is well worth it. And so here we have that image that we showed you during your report of findings, that road to recovery. Again, if your goal is simply temporary pain relief, you can ride that lower roller coaster up and down. Every time the pain comes back, you can come back in, we can get you adjusted, and you can do that every time the pain comes back. Or you can correct that subluxation, get your body functioning at 80, 90 or more percent so that you can prevent problems from occurring. So realize that diseases like cancer, heart disease, Alzheimer's, and subluxation, they're all silent killers. A lot of times these things do not have any symptoms until it's too late. It's been said that the average cancer patient has that issue going on in their body for 7 full years before the first symptom occurs. And I think we would all agree that that person was not healthy during that time. They just didn't know that they had it because they were waiting on the symptoms. And so all of these diagnoses, they don't wait. They don't care about your age, your race, your religion, your gender, your sexual orientation, or your financial situation. They'll all hit each and every one of us equally. And so what are we doing about them? What are we doing to prevent them? Because it's up to you what you do and how you do it. I can't make you do anything. But I ask you this question: what is your vision for your life 6 months from now? What is your vision for your life 6 years from now? And what action steps are you taking today that will lead you towards that vision 6 months or 6 years from now? Because you can achieve that vision. But can you achieve it if you have nerve interference? Because you cannot be fully 100% healthy if you have nerve interference. If your spine is subluxated, you cannot be 100% healthy. And so the whole chiropractic principle is about clearing out that nerve system of any interference so that you live an amazing life and you achieve that vision that you have for yourself, whether it's 6 months or 6 years from now. So God bless, and I hope you learned something from all of this, and I hope that it helps you to empower you to make better decisions for your life. Even if you were making good ones, there are always things that we can do to improve upon ourselves, because the greatest room in life is the room for improvement. Now, we do have some other workshops throughout the year. There are 5 Pillars of Health workshop series. In the central picture there, you see the nerve system, which is this new patient orientation. We also do workshops on positive mental attitude, nutrition, exercise, and getting the proper amount of rest and relaxation. And so we encourage you to register yourself for a seat at one of those workshops when they are offered. And again, we do typically offer one every quarter. So thank you for tuning in to our orientation series. And we look forward to not only adjusting you throughout the course of your life, but taking care of your friends and your family as well. That's why we do this, not only to help you, but to help educate others so that their lives can be exceptional also. Thank you. Have yourselves a happy and healthy day.